Good evening, everyone. Tian nasque nasne Mitzi Dean. Hajka siam nakwilia. I'm Mitzi Dean, MLA for Esquimalt Machosen. I use pronouns she and her. And I just spoke in Lekwungen language to introduce myself and say thank you to you all. And I did that out of respect that I'm here on the traditional territory of the Lekwungen speaking peoples, now known as Esquimalt and Songhees nations. My co-host, Sonia First Now, MLA for Cowichan Valley, is on the territory of Cowichan tribes and the Hulkaminam people. And I recognise that you may also be joining us from other territories throughout the province. I'm here live on behalf of all my legislative colleagues representing the Island Health Authority region, from Victoria to Cowichan Valley, to Nanaimo, to Comox Valley, to Tofino, to Campbell River and the North Island, and all communities in between. With us also are very special guests, Kathy McNeil, President and CEO of Island Health, and Dr. Richard Stanek, Medical Health Officer for Island Health. Thank you for being with us this evening and for all of your hard work through these unprecedented times. And thank you to all of your staff and colleagues. Just a few minutes ago, we stepped outside and cheered for those who have been working tirelessly to keep BC safe, who are making sure that British Columbians can continue to receive the essential goods and services that we need. And I want to pass along our heartfelt thanks to so many people: healthcare workers, care aides, people working in grocery stores, truck drivers, essential workers. Thank you for all that you are doing. British Columbians in my community, as well as across the province, have stepped up and taken the action that is needed, that we need to keep our loved ones and those who we don't even know safe. A lot of people around BC have been making huge sacrifices to help flatten the curve. I know that in Esquimalt to Machosen, this is especially true, and I thank you. And I'm really grateful to know our collective efforts are working. And we must not stop now. We mustn't waste all of those efforts. We have to continue to hold the line and remain 100% all in. We know this is a really difficult time for everyone, and we understand. And we know that people have questions, and that's why we're here tonight. From the beginning, our government has been quick to provide people with the latest information on COVID-19. Our province was amongst the first to provide daily updates. And I know everyone regularly tunes in to see Minister Dix and Dr. Henry. And we're grateful that the provincial government and health minister the COVID-19 effort. I'm now going to hand it over to my co-host, MLA Sonia Firstenau, to give us a quick overview of how we expect this town hall will go.
HKCM Mitzi, and thank you to everyone for joining us. And it is great to be here this evening virtually with all of you. As MLA Dean, as Mitzi stated, these are some very stressful times, and we recognize that everyone is doing their very best to get through this. And we are very grateful for everyone's dedication to beating COVID-19. In my part of the island here in Cowichan Valley, I'm so proud of the efforts, the volunteers, the way that the community has come together. We regularly meet as a Cowichan leadership group, and we celebrate and really are so grateful to the people that have stepped up in all over the Cowichan. It's my pleasure to introduce to you again Kathy McNeil, CEO of Island Health, and Dr. Richard Stanwick, the Medical Health Officer for Island Health. And would you both like to introduce yourselves and tell us about your roles?
Well, thank you, Sonia, and good evening, everyone. And it is a pleasure to join you all tonight virtually in our homes where we're supposed to be. I'm President and CEO of Island Health. It's a great privilege and honor that I have to lead this organization, and I work with a fantastic team. And I want to also offer my thanks and appreciation to the more than 20,000 people that make up the Island Health family who are working so hard to protect our communities around this novel virus that has come to our land and ensure that we're doing everything we can as citizens and as healthcare providers to flatten the curve. Glad to be with you tonight.
Hi, my name is Richard Stanwick. I'm the Chief Medical Health Officer for Island Health. I too share Kathy's sentiment in terms of all the sacrifices people are making by staying home, and maybe I wouldn't say watching us as a sacrifice. We're hoping that we will be able to, in fact, answer your questions. And for me, as the Chief Medical Health Officer, this is something that, in terms of experience, it's unparalleled. I had the opportunity to be, at that time it was VHA, when we had SARS and had a very close call. It was a very serious condition, but fortunately BC was well ahead of the curve and didn't, again, experience significant impact. We certainly saw the impacts of H1N1, but nothing rivals the pandemic. This is a career-defining event. It's a community-defining event. And I'm just so proud of all of the people that I have the privilege of working with. But as somebody who has the responsibility of the health of the community as well, it is just my heartfelt thanks to all the sacrifices that people are making to keep this virus at bay as much as we can. And I'm really looking forward to answering your questions tonight with my CEO. And of course, our MLAs can always chirp in, and I hope they can give us some context as well. As I say, everybody has, I think, a perspective, and we love hearing about them.
Thank you both very much. And just to give some context, people were asked to submit their questions on COVID-19 ahead of this town hall. And Mitzi and I will take turns reading out those questions, and either Kathy or Dr. Stanwick will address them. If you didn't get a chance to submit a question ahead of time, you can submit your questions in the comment screen below, in the comment section below. And in fact, you can start submitting them right now. And before we get rolling, I'd like to note that we received a large number of questions, somewhere in the area of 300, I believe. So we won't be able to get to every question, but we're going to do our very best to answer as many as we can. And if we don't get a chance to respond to your question, they will be addressed outside of this town hall if you provided an email. And so with that, let's get started.
Thank you, everybody. So let's start with something that's been on the minds of just about every British Columbian. What can you tell us about our province's COVID-19 testing strategy? People like Felicia from Saanich asks, when are we going to start testing anyone with symptoms to get a better sense of community transmission? And Alex from Victoria would like to know why testing has been so exclusive. I think I'm not the only one assuming the actual numbers of cases have been way higher, as many people have been turned down to get tested or just told to self-isolate if they have symptoms.
Okay, perhaps I'll try answering that question. I'll start with the second one first. I think it's important to emphasize that we have a limited capacity to do a rapid turnaround in testing on the island. We can do about 460 tests and have those results in the hands of clinicians the same day. So this is a very precious and limited resource. We don't have the capacity of, for example, the Lower Mainland, where they can do 9,000 tests in a single day. So we have been somewhat selective in who gets the testing so that important groups like long-term care workers, people who are in long-term care, medical providers, again, individuals who might be part of a cluster or may in fact be a positive case. And so that we actually, for a while, were restricting it to those people who were most essential to our operation or could suffer the most dire consequences. The potential for expansion on the island, again, is still limited. If we were going to, and it does look like we will be expanding testing criteria to be more inclusive so that people, as Minister Dix has said, who have respiratory symptoms will be able to contact 811 and get referred to our centers. And again, it's by referral only, and we will be testing members of the general public. This again is going to be useful because it will give us some indication about how much disease is circulating in the community. One of the reasons we've held back is that earlier in the season, there were many other respiratory viruses circulating. So if we were going to ask the general public to come forward, they would be coming forward with cases of the common cold, influenza, respiratory syncytial virus, and we would have probably overwhelmed our testing system. So for the first little while, we prioritized it. It's now being expanded, and we will continue to use this testing as a means to follow the virus in the community. this opening up of the testing, in fact, is one of the strategies to see whether the COVID-19 virus is staying with us or is it going to move on like many other viruses and sort of disappear during the summer months, only to return in the fall. So testing is a very valuable tool, but we try to use it wisely, and given the capacity on the island, limit it to when we need it most for the high priority populations. But now we have a much better sense of what's going on, and it's opened up to the public, but by referral only.
Thank you.
Can I add just one thing? If people want to know whether they should actually come in for testing, I've got to give the commercial for BCCDC self-assessment site. Please go to BCCDC. I've done it myself just to see it. It's an excellent resource to tell you whether you should, in fact, be calling 811 for a referral.
Thank you for that, Dr. Stanwyck. Our next question is from Harriet from Lanceville, and it's about people on the island also curious about different ways of testing for COVID-19. And her question is, does the province intend to eventually test everyone in BC serologically for COVID-19? And if so, what might be the time frame for doing that? And perhaps whoever answers that could explain what serological testing is as well.
Serological testing is a tool that we actually use for determining whether you, for example, are immune to hepatitis B, whether you basically have the measles virus. What it does do is measure the presence of a certain antibody. It's called IgG. I'm sure people probably have seen this referred to on the internet if they've looked this up. And it's evidence that your body has familiarity with this particular invader. And so your body has responded by fighting it off with this particular style of antibody. By measuring it, we can say, yes, you've had experience with that disease and are likely immune. Now, in terms of the current situation, Dr. Henry just a few days ago said we're probably a week away from the initial use of the serology to see if we can basically use it as a tool. The test that they've actually are going to be deploying is going to be verified that it's appropriate and it picks up what we want. There's certainly the intent to make this widespread in terms of testing. It may be linked to actually a survey of the population around the whole phenomenon of the COVID-19, and it will be a very effective tool to know exactly how much spread there has been, what proportion of the population actually has had the virus. And we've certainly had questions locally about people who've had very minimal symptoms or even asymptomatic, and the serology will pick those people up. Whether or not we'll be testing the entire population, I think the number that has been cited is thousands of people will be tested. There may also be an opportunity for the private sector to perhaps have a role with specific industries to look at those workforces. So this is going to be a tool that you'll probably see in widespread use, but not for probably at least a couple of months.
Mitzi? I'll just go ahead with the next question. So another question that we've received a lot, and I'm sure that you've gotten a lot, is around disclosing information about where confirmed cases of COVID-19 are. Swapnali asks, why didn't Vancouver Island Health Authority declare city names with positive cases on the island?
Well, I think probably the main reason we did that is that given the circulation of the virus in the community, I think we have to assume that it was already in your community. We know from people who had mild symptoms that would be a false sense of security. If we didn't name your community, you could assume that perhaps it wasn't circulating there. And what we really wanted the public to do is to assume it has and practice all those measures that Dr. Henry kept reminding us about, the social distancing, the physical distancing, coughing into your arm, and of course, if you're sick, stay home. So this was the main reason we really didn't want to give a false sense of knowledge that we really didn't possess. The second reason that we don't really release even that sort of information is in many small communities, one might be able to figure out who the person was. And one thing we wanted to avoid was the stigma associated with COVID-19. And it was certainly very common when it was first identified as a condition. And in fact, when foreign travelers were coming back with certain nationalities, there was actually discrimination against them because it was thought it was somehow their disease. And so to want to have people come to us if they were symptomatic, we certainly didn't want them to feel that they were stigmatized. The one thing I just want to close with is, from time to time, when we couldn't identify all of the contacts and speak to them directly, we occasionally released information about where somebody with COVID-19 may have been. So a bar or a gym might have been identified, and if you attended during these dates, please contact us. But that was the only time that we actually got specific in terms of geography.
Thank you.
And we know that a lot of thoughtful and collaborative planning has taken place in response to this pandemic. Taylor asks, engaging and partnering with patients and families is a priority at Island Health. Their voices are seen as foundational component to informing change. In navigating our local COVID response, Island Health leaders are making critical decisions by the minute. How are patients and families contributing to this rapid policy and practice changes and decisions?
Well, thanks for the question, Taylor. And it is very important that we engage patients and families in these system decisions, because they're often the ones who are most impacted. And here at Island Health, we're very lucky. We have an active patient advisory council who we rely on heavily to help us with some of these system-wide questions. As well, each of our quality councils for the clinical programs that we run have patient voices, patient participants, advisors who are helping at the program level. Some examples of how our patient voices have been engaged in our COVID-19 planning. As you can imagine, we really took seriously the changes to our visitor policy, knowing the impact that would have to patients and families. And so felt it was important to engage our patient advisors in that decision process, and they were very helpful to us. We've also benefited from the advice of our patient advisors as we've moved so much of our care to virtual care solutions, much like what we're using tonight, and so that we could keep care accessible at a time when we're still using physical distancing, and our patients helped advise us on that in that way. As we plan for our response around COVID-19, we've had to reorganize in some ways where we locate patients, and we call that cohorting. And our patient advisors have helped us work some of those issues out and give us some advice on how patients should be brought together who have common care needs. And I think the final piece of work that I'm aware of anyway, and I'm sure there's many more, as we work through what our code blue response would be in the context of having this novel virus, sometimes not knowing what patients might have this virus and protecting our healthcare providers who respond to code blue, our patient advisors were part of that discussion as well. And so we know we make better decisions when we have patients and families involved in those decisions, and we're very grateful to them for the help that they've provided.
Thank you for that, Kathy. British Columbians have been making pretty significant sacrifices for these past several weeks during this pandemic to flatten the curve, and for that we are all truly grateful. However, people do have some questions about these measures. So Megan from Nanaimo has this question. What is the science behind saying not to visit with your neighbors over a fence while keeping 2 meters distant? Similarly, why are we advised not to visit with a few family members in a backyard, all the while keeping the 2 meter distance and not sharing any material items?
I'll give it a stab. I think we've been listening to Dr. Henry in the last couple of days. These measures were really an attempt to keep people in their homes and as separate as possible. She was already talking about what sort of intelligent relaxing of basically the restrictions could be in place, maintaining the physical distancing, but perhaps increasing the amount of social interaction. And she was even talking about restaurants and many other places where we put in these restrictions as an attempt to keep that curve flattened so that our hospitals did not get overwhelmed like Italy and other communities that didn't take those actions. And so now we're looking at this opportunity that I wouldn't say under control, but certainly the curve is certainly far superior to many other jurisdictions. And she has already indicated that we'll probably do this in a very measured fashion that each time we'll probably do something for a couple of weeks, see what that has done to the curve, and then move on to something else. If it's successful, obviously we keep it. If not, then we look to something else. And this idea of increasing the opportunity for social interaction, I suspect is something you're going to hear more of in the coming days, because as the weather gets nicer, and given that we keep encouraging people to not only improve their physical fitness, but I think from a mental health perspective, we are social creatures, and that interaction is good for our mental health.
Thank you for that.
Thank you so much for all of this information and for all of the expertise and details. Martin in Mill Bay has a similar question. He asks, I keep hearing folks in the health authority say, hold the line. But when I Google that, I don't get any specifics. Cars still whiz by my road. Shopping centres appear to be busy. Folks appear to be going about their lives, albeit at 2 meters apart. What specifically and precisely does it mean to hold the line?
Well, I think what it really means is to somehow maintain the original set of orders and requests by Dr. Henry. And that is, again, this whole idea of engaging in the social distancing. There was a whole, I would say, suggest a significant amount of learning that took place in terms of how we actually had to change in the way in which we interacted. People staying home, even here at the health authority, when we have our meetings, chairs with big X's on them, so reminding us not to sit in them so that we have the right social distancing or the physical distancing between different members of staff. And I think part of what that hold the line means, and Dr. Henry has articulated in another couple of fashions in saying, we've got to consolidate what we have. We keep doing what we're doing. We know it's not perfect, but look what we've accomplished. And again, I think this holding the line will be something that she's already looking at, and what can we do to modify our behaviors and still keep the benefits that we've accrued. Again, the amazing accomplishments of Vancouver Island in flattening that curve is just amazing. And that's the only way to describe it, that people have responded in a fashion that have basically meant that, and then I'll let my CEO speak to it, the number of people we actually have in hospital at this point in time because of us holding the line. And I'll give it over to Kathy to give the good news.
Well, I think just to put a fine point on what Richard's saying is holding the line means that we don't grow. So we don't let this virus grow among us. And I think, you know, we could, I think I feel very grateful and privileged to live on Vancouver Island, because I think we've demonstrated that we can maintain a quality of life and still put these protections in place. And so to Richard's point, you know, today, for example, we have, we're so lucky, we have 5 people in all of the hospitals across the island that have a COVID diagnosis. So that's not the scenario we had planned for. And that is a direct result of the work that people are doing in the community. So, so that's what holding the line looks like, is to have a health system that's not overwhelmed, and to have people respecting each other's distance and respecting the advice of our provincial health officer and our Minister of Health. I think that's really the image of holding the line here.
Thanks so much for that, Dr. Stanwyck and Kathy, and I think that leads very well into the next question. So the Premier, Minister Dix, and Dr. Bonnie Henry have shared that the decision to cancel elective and non-urgent surgeries was one of the most difficult measures that they had to take to prepare our hospitals during this pandemic. And this has had a profound impact on people who are waiting for surgery. And it's certainly something that we've heard in our constituency office. I'm sure Mitzi has heard in her office about the impact on individuals who haven't had their surgeries. So people on the island, such as Rona in Campbell River and Dwayne in Victoria, simply want to know, when will the elective surgeries start again?
Mm-hmm. Yeah, it's a great question. And I think to the point that Richard made earlier, and Dr. Henry made reference to this last Friday, we're in a phase now where we have seen that we aren't having the experience we planned for. So we're now starting to plan for coming out of this phase. And Michael Marchbank, who had been the CEO for Fraser Health, has been named by Minister Dix to help guide the health authorities in the planning for what we call surgical ramp up. And we'll be doing that very carefully because we want to make sure that we adhere to Dr. Henry's advice around physical distancing, and that we don't threaten the resources that are here in the health system if there happens to be a cluster of patients for some reason that require hospital services. So we're thinking of kind of 2-week windows of how we might ramp those surgical procedures up. I think it's important to say, I do want people to know across the island, we do surgeries today. We're doing about 30% of the normal volume of surgeries that we would be doing in a pre-COVID state. Those are people who have trauma, accidents, might have a heart problem, who come through our emergency department. So there are surgical procedures being done every day. And I also want to say that if people have their procedures have been postponed and they're suffering, or their condition has declined, or they're suffering in a new way as a result of this new weight, please contact your family physician or your surgeon's office. We have the ability to reassess your clinical signs and symptoms, and we do have the ability to do urgent surgical cases. So surgery is happening. We are planning in a very controlled way to ramp those services up. Minister Dix has given a general kind of timeline sometime in May. We're doing that with our other health authority partners so that we're learning from each other and doing that together. And I do want to say, here on the island, I think it's a real opportunity for us to hold on to some of the innovations that we've seen during COVID, holding on to some of the virtual care solutions that we have in place so that we can make sure that we have a new normal for surgery and not necessarily slide all the way back to what it might have been like before.
Thank you very much for that. And similarly, Chris on Quadra Island also has a question about the pandemic planning. He asks, why have you chosen to place COVID patients in our main hospitals and not in repurposed alternative, highly quarantined facilities? Many vital services such as imaging are being delayed.
Yeah, that's a great question, Chris. And as people have watched this across the world, each jurisdiction has done something slightly different based on what resources they have. I will say here on Vancouver Island, well, in British Columbia as a whole, we have fantastic healthcare facilities. We have state-of-the-art equipment, and we have wonderfully trained healthcare professionals. And we know with this illness, people can decline very quickly. And so proximity to critical care and services like dialysis or highly specialized critical care talent, it's really important to have that close proximity so that we felt it was important to identify what we call primary COVID sites early on that had critical care capacity, had 24/7 access to the talent, the workforce that we needed, respiratory therapists, intensivists, the highly trained nursing staff, the other members of the health team that are so important for these patients. What those primary COVID sites, by identifying them at the Royal Jubilee and Nanaimo Regional General Hospital, it's allowed us to do very concerted planning in those locations so that the staff know what the processes are, they know what the protocols are, and so that we know that we can deliver the highest quality treatment to patients who might need that level of treatment, who might be suffering from this COVID virus. I acknowledge, though, by doing that, there are some trade-offs. So some of the clinical services that would typically be offered on those sites, we've had to tool down to enable our COVID response.
Thank you for that, Kathy. That's very helpful. People on the island have questions about how COVID-19 is transmitted. Can you address a couple questions on this? For example, Deneen from Victoria asks, is it possible to transmit COVID via our hair? And should healthcare workers wash their hair immediately after coming home from work?
It's interesting that I think we've seen certainly all sorts of trials on how long the virus lives on different surfaces. Some of it's surprising. And I don't know if anybody has actually done hair yet, but what we do know is if somebody does practice good hygiene, including washing your hair with a good shampoo, because the outside coating of the coronavirus is lipophilic, which is fancy to say. It's based about a layer of fat around it. It is easily destroyed by washing. And so if somebody is concerned that they have been exposed in a fashion, somebody has coughed on their hair or whatever, they've touched their hair and may have had the COVID on their hand, a thorough washing is all that's required, just like we do with other surfaces that, whether it's your body or your home or your vehicle, any of the good sanitizers will do the trick. This virus is very susceptible to interventions that are provided by simple cleaning. I do have to say I've seen the first cat in the video today.
Puppy, actually.
Puppy? I know. Yeah. There's a contest to see who can actually see the first pet that wanders through. So, yes.
Thank you, Dr. Stanwyck. That was some good advice there. And our next question is from Noreen, but it's also one that I've heard out in the community as well. Some retailers accept cash and other retailers will not. Does money get contaminated with the virus or not? If yes, how long would the virus remain on coins or paper bills?
Again, the potential is always there for it. It's not being described as a major vector, but I know as that extra step that people are taking is a cash only, or sorry, a credit card only tap. Tap the screen and the screen is wiped between taps of the credit card. And that's probably the safest way of basically exchanging currency. And in other locations, people have found ways where they expect exact change and only handle the money with gloves. So there is always that very low potential, but I think it goes back to that basic tenet that Dr. Henry keeps reminding us. If we use hand sanitizer frequently when we don't have access to good hand washing, you may refer to it as dirty money, but you can always have clean hands.
And also the advice you gave us at the beginning of this, which is don't touch your face.
Yes.
Yeah. We've received a lot of questions about PPE, so personal protection equipment. Wayne in Nanaimo asks, why is VHA telling their employees that VHA will be recycling masks? Masks such as the N95 and surgical masks are not designed to be recycled and used again. The sterilization of the used masks will alter the fibers from which the masks were made, putting our healthcare workers at risk of contracting many viruses or diseases. This is unacceptable. VHA should be supplying new PPEs. Could you respond to that? And I've heard that question a lot from people.
Yeah, sure. So this is a topic that takes a lot of our time and energy, personal protective equipment. And I think the reason it's such a challenging topic is because the entire world needs it right now. And so many countries and jurisdictions are looking for the same equipment at the same time. We early on heard from other jurisdictions who were ahead of us that there was an opportunity to reprocess the N95 mask, which is a special mask that's fitted for people's face, and it has a HEPA filter in it, a special filter that blocks particles. So when we heard that that was possible to do this reprocessing, some very smart people here in British Columbia started doing some investigation in that. And there's a bright gentleman at Vancouver Coastal who cracked that nut for our health system and has come up with a process for reprocessing N95s that has been now certified by Health Canada. So what that means is Health Canada has stamped their seal of approval so that those reprocessed masks would be equal to a new mask that we would buy that Health Canada would certify. And so we haven't used those reprocessed masks yet, but it's a just in case. And so we have collected them. We've started that reprocessing process so that we have a supply should we need that. And the should we need that is because we have supplies coming routinely every week, but we just never know. Sometimes it's how much we need to use that actually drives how much we have left in the warehouse, in the storage. So we need to have these alternative sources or alternative ways. The other thing we've explored around personal protective equipment are what we would say, we have typical vendors or typical suppliers that we would buy from. In this circumstance, we are now buying from new vendors. So we may have masks that look different. And so what that means is they may provide the same protection, but they look and feel different. And so we have to do some education and training and potentially some fitting for these new pieces of personal protective equipment. So clinicians may see some new things in the mix and wonder about that. And again, it's just so that we can have alternatives and we can ensure that we have as many supplies available as possible to protect our healthcare workers and as well protect our patients.
Thank you for that, really informative. And similarly, as I'm sure you know, there's been a lot of stories in the news about masks and maybe some confusion as well. So Dan in Sydney is hoping that he's going to get some clarity this evening. With regard to the wearing of face masks, at first the advice discouraged their use, and now it seems unclear. Can you please advise if face masks are required?
Are we talking about the general public? I know, but perhaps we did get some direction from our Chief Public Health Officer, Dr. Teresa Tam, who basically said to the public, if you wish to wear a mask, that again, they would not discourage it. There's certainly a lot of cloth and other masks available, and they may in fact provide some protection, but I think what people have to appreciate is you're actually usually protecting other people from your own secretions and your own basically products that could in fact carry the virus. So when people are wearing a mask, it's probably as much protecting the people around them as it is protecting themselves. What we are asking is that people please not use, as we just heard from Kathy McNeil, surgical and other masks that will be needed in our acute care, long-term care, and other care settings to provide patient care. Certainly, if people feel better by wearing some sort of protection on their face, that's, Dr. Tam said, that's fine. But please don't dip into a scarce resource, and that is our PPE that can be used for medical purposes.
Thank you for that. And I believe now we are going to be moving to online to questions that you've been giving to us live. Just waiting to see as those turn up, but while we wait for that, this will be our final question before we get to the online questions. Everyone hears Dr. Bonnie Henry talk about what to do to stay safe and what we've been doing so far. Dan and Courtney has a question on other possible remedies. What's your stance on immunity boosting vitamins or supplements such as L-theanine, apple cider vinegar, vitamin D or C?
That is, I think, a personal choice. I think Dr. Henry's been very clear that we want people to get outside to get some exercise because we know that's good. We also know from a mental health perspective, that form of exercise is good for our mental health. In terms of these other remedies, we're still basically learning, and to the best of my knowledge, none of those other alternative therapies have been identified as being anything more than something that people feel protects their health. And we certainly wouldn't discourage somebody from taking something they feel makes them feel better or makes them feel stronger to fight this. But I think the main message is that we need to take the steps that keep us healthy. And again, that same message that Dr. Henry keeps saying, and if you are sick, please stay home.
Thank you for that. And so our first live question tonight is from Sasha, who asks, is it okay for patients to leave their rooms while they're waiting for COVID test results?
That's a tough question in terms of leaving the room. What we would probably do if somebody was waiting for a test result in a healthcare setting would be, in fact, have them wear a mask so that, again, their secretions wouldn't go into the air and potentially contaminate surfaces or be directly transmitted to another individual. So this would be an instance where this person might in fact be given medical grade PPE to ensure that they, because they're a suspect in terms of developing the disease, protecting others against them.
Thank you.
Thank you for that. And this is another one from someone who's been watching us live this evening and has sent a question in. It's from Catherine. I'm volunteering on a COVID-19 committee for the Strata Council where I live. We have an indoor pool and a small indoor gym. Some of our residents have asked us to open the pool and the gym with small limits of people using the facilities to allow for physical distancing. What would you recommend?
In the community, we have already closed gyms because of the concern about being able to clean them properly after each use. It's not just the physical distancing, it's that when people are exercising, they may cough, they're sweating, etc., they're breathing hard, and so the likelihood of droplet basically production is increased. And so that would be a setting which at this point in time, we have basically asked that gyms close, and this is a directive actually in Island Health as a medical health order. In terms of the pool, that's another matter. Again, this virus does love moist environments, and again, the concern would be the possibility of this virus being left behind and somebody else inadvertently, again, touching it, rubbing their eye, and picking up COVID-19. So again, I think a caution would be advised to that particular group about using those common facilities. Obviously, if you're lucky enough to have your own pool and your own family, well, that's another matter. But for communal property, I think they would have to think hard about the potential risk of COVID spread.
Thank you, Dr. Stanwyck. And you know, further to what you said earlier about all of us doing our best to stay healthy, people definitely want to be exercising. And as we have better weather, that exercise can be happening outdoors. However, Mary asks, should we be concerned about biking or running past someone on the street or a bike lane? Two-way bike lanes are a concern as it's impossible to safely distance when passing other people.
That certainly has come up as an issue, and and again, I can just say that people have two minds. Some people still feel that because some people may be reading hard and some people are really avid cyclists, and so there might be a slight concern about droplet spread. On the other hand, people say if the contact is so brief, it's not that you're spending 2 hours with somebody in a confined environment like a room or indoors. So that I think the estimate is that it's still a very low risk likelihood for exposure. But nevertheless, I think we have to realize there's no such thing as any activity that's without some risk.
Thank you. And thank you to everyone who's been sending in questions. Thank you to Ali. Ali asks, are you concerned about the lack of herd immunity given the low incidence rate on Vancouver Island and implications for a potential second wave?
Excellent question. That is one. By flattening the curve, what we have done is basically prevent the virus from successfully transmitting. I can tell you that we've only had 14 of the 109 cases have actually been as a result of community spread, where we haven't been able to track it back to either foreign travel or basically existing clusters. So there is a concern that this flattening of the curve is merely a delaying tactic. And as Dr. Henry has suggested, we're likely going to see waves of this virus, and each time we'll probably have to step up until we have a vaccine. Now, I know some countries are looking at dealing with this differently. Sweden is going with an open model, and I think might be embracing what we considered community immunity. But there's a grave risk, as we've seen, associated with that, and a good example is Italy. And so I think at this stage, what we're trying to do is continue to keep the pressure off our acute care system and buy time so that we can have a vaccine in place. And of course, with the serological testing coming along, we will have a good idea of exactly how much herd immunity we have in the community.
Thank you for that. And our next question is one that my mom falls into this category, and it's a question she's raised as well. Should fit seniors age 65 avoid grocery trips? Not clear on the advice. Shouldn't we be leaving overburdened delivery services to the 80+ frail elderly?
I would suggest that, again, one, if people are going to go grocery shopping, it's not a daily activity. This is what many seniors are actually struggling with. It's been a very social activity where people pick up their one-day supply. If your mom and others are going to go shopping, please try to get a shopping list together, go out once a week. The grocery stores are getting very good at ensuring the physical distancing, and so therefore would probably be a safe, relatively safe activity. And certainly for the delivery services, that is an important service for many of the seniors who are housebound. So it would be a contribution to our fight against COVID-19.
Thank you.
Thank you so much. We've got a lot of engaged people sending in questions, so thank you for all of that. Thank you, Clint. He asks, is there a working number of the percentage of the BC population that has had the COVID-19 virus and recovered at home on their own?
The answer to that is yes, but we don't know how large that number is. That's what serology will hopefully uncover, that we will find out how many people were so mildly symptomatic that they didn't even realize that they had the virus. We do know from some very early aggressive testing done at Vancouver Coastal with healthcare providers that some people had as little as a single cough and a sniffle and yet tested positive for the virus. So there's a full spectrum of illness from people who barely know that they've been sick, and people even argue asymptomatic entirely, to unfortunately people who end up in our intensive care units on respirators and with very bad outcomes.
It really hits home that this is a new virus, and we're still learning so much, and I'm so grateful that the healthcare professionals and doctors are putting so much effort into learning. Joel asks, I have mild asthma. Can I catch COVID-19 easier, and will I get sicker because I have asthma?
Asthma is a chronic condition, and so that is certainly one of those situations in which if one acquires the virus, it will be a greater challenge to their body because the lungs are already addressing the problem with the bronchospasm. Now, what we've been advising people, and as soon as we saw an inkling of the fact that this virus was coming, was that we want people to get their chronic conditions under optimal control. Even though doctors are available and the emergency department is there for you should you need it, the best thing to do is really stick to those social distancing, the physical distancing, get the exercise, keep your lungs in tip-top shape, because you will be likely going to experience some more significant symptomatology if you catch it. But again, avoid it, and again, control it.
Thank you. Really important information here this evening. And Dr. Stanwick, you talked earlier on about moist conditions for the virus, and Jen is telling us, I leave my groceries where it's cold. Can the virus live longer in this environment?
Again, we haven't specifically, I haven't seen the papers that they have looked at that specifically, but we do know that it could be a situation if we can maintain the moisture, then the likelihood is the virus is going to have an environment where it can still continue to exist. So those conditions that propagate moisture ensures a longevity of the virus. So again, this is why, and again, this is one of the simplest ways of addressing this virus. Good old sunshine is deadly to this virus. And so sometimes people say, what's the best thing you can do if you're worried about the surface? And people talk about their cars. Well, I haven't been in my car for a couple of days. I said, has it been in the sunshine? Answer is yes. Well, that virus is not likely going to be there. So we are learning. We know that our common household cleaning agents work well. Sunshine works well. But again, it's this idea, probably we still have to take those personal protective measures of washing our hands and making sure we don't touch our face. And probably the other piece I didn't mention is good old cough etiquette, which we learned from H1N1 of coughing into your elbow. I know Rick Mercer made a joke of coughing into your knee, but only those who are really physically adept could accomplish that feat. But the answer is don't cough into the air, please, into a tissue or into your elbow, and throw that tissue away and wash your hands. That's probably the best advice I can give tonight.
Thank you for that. Tamara asks, as a personal housekeeper, should I even consider going into or in and out of 3 or 4 homes per day? Most of my clients are over 65.
It's a very good question. That again, so much of it depends on the individuals that she's basically providing service for. It's interesting that a lot of individuals are concerned that they've actually canceled those very services because of the concern that people, if for example she acquires it, she could technically pass it on to each one of those individuals, or one of those people were there. And so, the challenge is that maybe if the house cleaning could be done with the people practicing that significant social distancing or even being absent when she does the cleaning, you might be able to make some sort of accommodation. And this is the bit that I think Dr. Henry keeps emphasizing. How are we going to learn to live with this virus? What steps can we actually put into place that will continue to keep that curve flat, but allow us to be able to do work? And so this is going to be one of the big challenges. And I know that our provincial government has a number of, well, and I'm sure you know, many branches of government looking at the impact of what this virus has done to our economy, to other aspects other than health, and how we can get back to some form of normal, though it'll never be the same normal that we had prior to this pandemic.
Mm-hmm. Yes, thank you so much. And now we have Dylan, who's asking, could Dr. Stanwyck speak a little to viral load? There's a great deal of concern that if there is a detectable amount of COVID on a surface, that it will lead to a guaranteed transmission.
Good question. In terms of actual number of particles of virus, it's still early. I know, and we have studied this. I mean, for example, with norovirus, which causes the gastrointestinal symptoms, we know as few as 20 viral particles in a virus that's shed in the billions can give you a case of the disease. To note, we do not, at least I have not seen the papers yet that speak to exactly how many viral particles are needed to basically cause the infection. So at this stage, it is certainly a very worthwhile academic question that hasn't been answered. And I think for now, we don't want that question answered by actually people, falling ill. That's why we're doing so much emphasis on basically disinfecting surfaces and recommending all those practices. But no, it is certainly something that in terms of science, that will be a question that will be pursued going forward.
Thank you. Andrea asks about, as we start opening up the island to people working, are we going to start testing everyone rather than just those with symptoms so that we can ensure that asymptomatic carriers are not serving and infecting the community?
The dilemma with that approach is that this is a very, the test we use is very poor for basically ruling out disease. So that if you are asymptomatic, we know that the ability of the test to identify those individuals who actually have the virus may be as low as 50 to 70%. And so then what we end up doing is creating a false sense of security that, oh, this person, even though they've got the sniffle, it's okay, they've been tested. So what we do know that the further you are on in the disease course, say day 2 or 3 with full-blown symptoms, the test is way better. So we really don't have a way to guarantee somebody that to know whether in fact they've got the virus. What we might be able to do, and this is where serology is going to come up, if in fact we can get that serological test going, and we know that the serology levels of the antibody is in fact associated with immunity, that may be the way in which we can have people returning to workforce safely, because we know they can't pass the disease on because their bodies had it and they won't let them get it again and they won't be able to spread it. And that's the other big question. If you are immune, is there the possibility for transmission? So these are questions that are going to be answered in the immediate future, but not right now.
Thank you. And Roman is asking, with the use of hand sanitizers so ramped up during this crisis, is there another potential threat looming due to misuse of such products?
Well, I think probably what we are doing is using a chemical to disrupt the outer membrane, the fatty membrane around the virus itself. So this is a chemical assault. And so the good news is that viruses have not developed a trick yet to be able to ford off the agents disrupted the membrane around it and cause it to die. On the other hand, frequent use in hand washing. I know people have reported about their hands being raw and cracks, and certainly we have to be careful about the judicious use of it. And these are chemicals, and we have to remind ourselves. And that's why we, rather than the hand sanitizers, where possible, soap works just as well if you can get access to it, and do your 20-second hand wash. And again, I'm going to remind the public that if you have soil on your hands and you use a sanitizer, it may not effectively remove all of the virus. So that's why we keep emphasizing hand washing. There's lots of soap available, and there's no while there may be a scarcity of sanitizer.
Thank you. And this is going to be our last question, and we have to move on to wrap things up. Dawn is concerned about people who could lose their place in long-term care homes if they leave for blood transfusions. And she asks, why can't life-saving blood transfusions be brought into care homes during this time so that the elderly won't be forced to leave and potentially catch the virus or not be allowed back into the home?
And maybe I'll take this, and Dr. Stanwyck may have more to add. But I think it's a really good question about what, I'll take it up a level and use blood transfusion as an example. And that may be a very complicated example because giving a blood transfusion is a very complicated activity. But things like certain medications, like intravenous medications or some other treatments that we haven't necessarily been able to deliver in long-term care, as we've worked through the changes in the health system that allowed us to, what I say, quiet the system somewhat, we've put some new innovations in place, and things like caring for people in place, enhanced home support, for example. Those are things that out of necessity we've tried, and now the opportunity is to hardwire those into the way we continue to deliver healthcare moving forward. So should there be a point in time where we do more acute kind of activities or treatments in long-term care? I think that you will see us changing our care model so that we bring care to people rather than have people come to care. And I think to the point of losing a spot, that we never want that to happen. That's someone's home. And so much like we bring care into people's homes, we can bring that care into long-term care in a very safe way. And so there's been lots about this COVID-19 experience that actually has been an opportunity for us to learn and change some of the ways that we do our core service delivery.
So thank you for that. That's very helpful. And I just have one question that has come to my community and through my constituency office quite a bit. And I know that my colleague, MLA Adam Olson, has also had this as the representative for the Gulf Islands. And that is people asking why communities aren't being blocked off. So when we're in a tourism area, and there's an influx of people, and I know when we had the Easter long weekend, this was a very big concern. Could you just speak a little bit to that question that people are raising about not choosing to stop all travel or stop the ferries or stop people from traveling into communities?
Yes, and I know this is certainly something that many of us have posed to Dr. Henry, and the feeling was that she still is calling on people's goodwill and good nature to actually stay home. Though we also have to, and again, this is something that does happen, that people may be traveling from other locations because they've got a sick loved one. There could be circumstances where they are in the neighborhood for reasons other than just to enjoy the amazing beauty of the island and the tourist attractions that normally are a great source of business and basically a great form of exercise and enhances mental health. We do know that there have been some people who continue to, I guess I hate to say it, but bend the rules, as Minister Dix has said. And again, what we're hoping that fewer and fewer of those. But at the same time, I think we have to be kind to individuals and recognize that for many of them, they're there for a really good reason. They're not here just for a frivolous reason. The question is, it's not easy to differentiate. And the last thing we want to do is perhaps upset somebody who's already there for a reason that is already personally very, very trying. So what we do want to do is attempt to continue to emphasize to people to stay home, enjoy their own dwellings, and at some point, if we can keep this curve flat and learn how to live with this virus, we will be able to find a way to at least have some limited return to what was the way in which we used to behave.
Thank you for that. That's a great answer to that question. And at this point, I'm going to hand it back over to you, Mitzi.
Thank you. Well, we're just wrapping up now, and I want to say thank you to everybody across British Columbia who is staying home and doing their bit to protect us all. So I wanted to say that thanks first, and of course I want to say thank you to everybody who joined us this evening, my co-host, MLA First Now, Dr. Stanwyck and Kathy as well, and thanks again to all of our staff in Island Health and to all essential workers across our communities. And thank you to Minister Adrian Dix and Dr. Bonnie Henry for all the work that they're doing. Our government continues to work hard to support British Columbians. And I think that everybody across the globe is finding their approach very professional and full of leadership as well. So before we do wrap up, we're going to leave you with a few additional resources. Sonia, you're going to go first.
Thank you, Mitzi. So for provincial support and COVID-19 information, please visit www.gov.bc.ca/COVID-19. For seniors looking for additional support at this time, you can call 211 or visit www.bc211.ca. And if you or a family member needs additional medical advice, you can call 811.
And for the latest medical updates, including case counts, prevention, risks, and testing, please visit www.bccdc.ca. For the Provincial Health Officer's orders, notices, and guidance, visit www.gov.bc.ca/PHO guidance. And for non-health related information, including financial, childcare, education supports, travel, transportation, and essential service information, visit www.gov.bc.ca/COVID-19 or call 1-888-COVID-19, which is 1-888-268-4319 between 7:30 a.m. and 8 p.m. 7 days a week.
We also want to encourage anyone who has a question about their care experience with Island Health to contact leadership at the facility where care was received or their patient care quality office at 250-370-8323 or toll free at 1-877-977-5797.
Even in these unprecedented times, everyone deserves to feel safe. If you're facing violence or assault, or if you know someone who's at risk, please call Victim Link any time of night or day. And the free helpline number is 1-800-563-0808. And remember, please follow the public health guidelines so that we can all help protect our families, our friends, our neighbours, ourselves, and the people we haven't even met yet. These very basic measures continue to be the most important.
Stay at home when you're sick. Wash our hands frequently and for 20 seconds. Cover your cough and sneeze into your elbow. Dispose of tissues appropriately. And don't forget, even though we're staying apart, let's stay connected.
We have 2 more virtual town halls this week. For more information, please go to www.gov.bc.ca/COVID-19 town halls.
Thank you very much, Dr. Stanwyck and Kathy. Thank you very much, Mitzi, for co-hosting. It was a real pleasure, and thank you to everybody who came out tonight.
Thanks for having us.